Hello and welcome to the topic Adjustment Disorder with Depressed Mood in the Psychiatry module. By the end of this topic, you should be able to define adjustment disorder with depressed mood, discuss the pathophysiology and causes of adjustment disorder with depressed mood, describe the clinical manifestations of adjustment disorder with depressed mood, discuss the management approach to adjustment disorder with depressed mood, and finally, discuss the complications of adjustment disorder with depressed mood. Let's get started. Adjustment disorder is a behavioral disorder which is a maladaptive response to a psychosocial stressor that occurs when an individual has significantly difficulty adjusting to or coping with a stressful psychosocial event. Adjustment disorders are caused by significant changes or stresses in one's life. Genetics, life experiences, and temperament may increase one's likelihood of developing an adjustment disorder. The pathophysiology of adjustment disorder varies depending on the quality of the stressor, where it could be brief, prolonged, interpersonal, material, etc., and upon which symptoms predominate. Distress and disorder occur when the need to adapt exceeds the person's capacity to maintain psychological or physiological equilibrium. Stress reactions may affect many elements of behavior, including sleep, impulsivity, or behavioral constriction, autonomic functions like heart rate and blood pressure, digestion, movement, and sensitivity to pain. Some of the things that may make one more likely to have adjustment disorder include stressful life events, which could be positive or negative, that may put one at risk of developing an adjustment disorder, for example, divorce or marital problems, relationship or interpersonal problems, changes in situation, and adverse situations such as losing a job, loss of a loved one, or having financial issues. Also could be secondary to life-threatening experiences such as physical assault, combat, or natural disaster. Adjustment disorder could also be due to ongoing stresses such as having a medical illness or living in a crime-ridden neighborhood. As the term adjustment disorder implies, symptoms develop when the person is responding to a particular event or situation, for example, a loss, a problem in a close relationship, an unwanted move, a disappointment, or a failure. The pathogenic stresses may be single events or persistently stressful circumstances. Characteristic symptoms include low mood, sadness, worry, anxiety, insomnia, poor concentration, anger, disruptive behavior, loss of self-esteem, feeling trapped, and feeling isolated. The DSM-5 lists 6 different types of adjustment disorders. Although they are all related, each type has unique signs and symptoms. Adjustment disorders can be with depressed mood, where symptoms mainly include feeling sad, tearful and hopeless, and experiencing a lack of pleasure in the things you used to enjoy. It also could be secondary with anxiety, where symptoms mainly include nervousness, worry, difficulty concentrating or remembering things, and feeling overwhelmed. Adjustment disorder can also be present with mixed anxiety and depressed mood, where the symptoms include a combination of depression and anxiety, or it could be with disturbance of conduct, where symptoms mainly involve behavioral problems such as fighting or reckless driving, with mixed disturbance of emotions and conduct, where symptoms include a mix of depression and anxiety as well as behavioral problems, and finally, if they are unspecified, where symptoms don't fit the other types of adjustment disorders but often include physical problems and problems with family or friends or work or school problems. So one can use the criteria in the Diagnostic and Statistical Manual of Mental Disorders 5th edition or DSM-5. For diagnosis of adjustment disorders, the DSM-5 lists the criteria as follows: having emotional or behavioral symptoms within 3 months of a specific stressor occurring in one's life, experiencing more stress than would normally be expected in response to a stressful life event, and or having stress that caused significant problems in one's relationships at work or at school, and symptoms are not the result of another mental health disorder or part of normal grieving. Even in relatively young, healthy people, metabolic problems such as anemia or vitamin deficiencies may compromise stress response. Stressed people may under or overeat or use alcohol or drugs. If someone has anxiety or mood symptoms that are severe enough to prompt a mental health consultation, or if the person does not improve as expected, you can conduct a full blood count, comprehensive metabolic panel, vitamin D levels, as well as looking at thyroid function tests may uncover a treatable contributor to the maladaptive stress response. As for treatment, selection of treatments for adjustment disorder is a clinical decision. At present, no official consensus identifies an optimal therapy. Both psychological therapy and pharmacotherapy may be considered. And because adjustment disorder tends to be time-limited, brief rather than long-term psychotherapy is often sufficient. You may also consider pharmacotherapy, which may help improving coping through moderating symptoms such as insomnia, anxiety, or dysphoria. Useful agents include benzodiazepines, non-benzodiazepine anxiolytics, SSRI or SNRI, mildly anxiolytic antihistamines, and sedating plant extracts such as kava. The goal of pharmacotherapy is to ameliorate the debilitating symptoms of the adjustment disorder, reduce morbidity, and prevent complications. So finally, we can summarize that adjustment disorder is a mental and behavior disorder as one has adjusting to some changes or stresses in their lives. We have looked at the pathophysiology, causes and risk factors, as well as the diagnostic criteria based on the DSM-5 criteria. Investigations are mainly aimed at excluding concomitant medical illnesses, and treatment is targeted at psychological therapy in combination with pharmacotherapy. We have come to the end of this topic. Thank you for your time.